Good afternoon. My name is Peyton Thorne, and I am doing my presentation on the acid-fast stain in tuberculosis. So, what exactly does the term acid-fast mean? Acid fastness is a physical property that gives a bacterium the ability to withstand or resist decolorization during the staining process. And here's an example to my right here. So, what is the scientific name of the bacteria that is used with the acid-fast stain? So, that bacteria would be Mycobacterium tuberculosis, also known as TB. So, this is how you correctly write the scientific name. So, the M in Mycobacterium is capitalized, but the T in tuberculosis is lowercase, but both words are italicized. And this picture that I included here I thought it was a really cool picture of a 3D picture of the bacteria. So the chemical composition of the bacterial cell wall. This is really interesting in my opinion. So I included a picture to the right for you to take a look at while I go over the chemical composition. So this cell wall is resistant to most compounds. It's less permeable. It contains peptidoglycan. It contains a lot of glycolipids. It has a thick outer lipid-rich layer, and it has a high content of mycolic acids, which are really high in fat, which gives this cell wall a waxy coating. So, why is gram stain not recommended to stain Mycobacterium tuberculosis? So, Mycobacterium tuberculosis has a really high lipid count, like I mentioned in the last slide, and with the high lipid count, it gives it a really waxy coating. So, due to this, water-based stains such as the gram stain would not be ideal to stain the Mycobacterium tuberculosis disease, or bacteria, sorry. So, name the dyes and decolorizers that are used in this staining process. So for the primary stain, we have carbofuscin, which is a red dye, and we leave that on our slide for about 30 seconds. And the carbofuscin is lipid soluble, and it contains phenol, which helps the stain penetrate the cell wall. Next, we're going to do the application of heat. So we're going to place our slide over a pot of boiling water to allow the cells to heat fix to the slide. Then we're going to rinse with distilled water. Next is our decolorizer, which is acid alcohol. We're going to let the acid alcohol sit on the slide for about 30 seconds. And the decolorizer strips the stain from all non-acid fast cells, but does not permeate the cell wall of acid fast organisms. Next, we're going to rinse that with distilled water. And then last but not least, we're going to add our counter stain, which is methylene blue, again for 30 seconds. And the counter stain is used to add the background color, which is the blue color that we'll see. And then we'll rinse with distilled water. And we're ready to look at it under our microscope. Here's a really cool picture I found on the internet of the process for the acid-fast stain. So like I said, we apply the carbofuscin, which is our primary stain, which is the pink/red color, and then we do the application of heat. So we place our slide over a pot of boiling water to heat fix the cells to the slide. And then we have the application of our decolorizer, which is the acid alcohol. And then we have the application of the methylene blue, which is our counter stain. So you can see there that it dyed the background cells blue. So, how do you identify the microorganism in question after completing the staining process? So, acid-fast bacteria will be stained a bright pink color. Excuse me. And all other cell types will appear blue. So, in this image I included to the right, the acid-fast stain, the mycobacterium would be labeled as the letter B, and the letter A would be all other cell types. So in this image, we would want to look at B. So how do you get Mycobacterium tuberculosis? So the mode of transmission, how does this pass from one person to another person? So this travels through the air from droplets. You can get it through the mouth or the nasal passages, so your mouth or your nose, even your eyes. Touching will not spread it. It must be inhaled. It takes a prolonged exposure to get infected, so you would most likely get it from a family member or a coworker, not a casual acquaintance. So if I saw somebody at the grocery store and I stood next to them, I would not get it. Yes, if they coughed on me, I'd have a higher chance of getting it, but my chances are much lower than getting it from my mom or my dad or my sister or my brother, if that makes sense. And then how does Mycobacterium tuberculosis affect our body? So I'm talking about the pathophysiology. So I have a few bullet points here I want to go over. So Mycobacterium tuberculosis usually attacks our lungs first, but it can also affect the kidneys, the spleen, the lymph nodes, the brain, the spine, and more. And not everyone who is infected with TB gets sick. But if you do get sick, you may experience these, not all of them. A bad cough that lasts 3 weeks or longer. You would cough up blood, pain in your chest, weight loss, loss of appetite, chills, fever, sweating at night. There are many more, but these are the most common ones you might notice. You may also notice skin lesions, soft tissue infections, and serious lung problems. That is why it is important to catch this disease early and fast, or it can become fatal and you could possibly die. What are the 3 types of tuberculosis, you might ask? So for our most common one, we have active TB, which is an illness in which the TB bacteria rapidly multiplies and invades different organs of the body. Next, we have military TB, which is a rare form of active TB disease that occurs when TB bacteria finds their way into the bloodstream. And yes, this one is rare, but it is also deadly if not treated quickly. And then we have latent TB. So latent TB bacteria are dormant, meaning they are inactive or asleep, I guess you could say. And then once the latent TB bacteria becomes active, it can make you sick. Here's a good example of the comparison and differences of latent TB and active TB. So latent TB is not contagious, but active is. Latent, you do not have any symptoms, but active you do. And latent does not grow in the body, but active does. And who is most at risk for tuberculosis? So friends and family of the person who is infected, people from parts of the world with high TB rates, like India, Asia, Africa, people in groups with high rates of TB transmission, so the homeless, injection drug users, and people living with HIV. People who work or reside in facilities that house high-risk people, like hospitals, homeless shelters, correctional facilities, nursing homes, prisons. And continued from that last slide, we also have babies and young children. We have people with chronic conditions like diabetes or kidney disease, people with HIV or AIDS, cancer patients undergoing chemotherapy, and even organ transplant patients. So these people need to be extra careful. How is this bacteria treated? So latent TB, if you become infected with latent TB, but it is not active yet, you should get preventative therapy. This treatment kills germs that could cause problems if the disease becomes active. The most common preventative therapy is a daily dose of the antibiotic isoniazid, which also INH, taken as a single daily pill for 6 to 9 months, sometimes 9 to 12 months. You are not contagious if you have latent TB, remember that, but it can quickly become active and then become contagious. And then active TB, the most common treatment for active TB is also isoniazid, INH, in combination with 3 other drugs, rifampin, pyrazinamide, and ethambutol. And then you must take the medications as directed for the 6 to 9 or 9 to 12 months to ensure all of the TB bacteria is dead. If you miss just 1 dose or stop taking the medication once you feel better, the bacteria may become resistant to the antibiotics and be worthless. Here's a comparison chart. So the infectivity, latent is non-infectious, active is infectious, the different symptoms. Latent will show a normal chest x-ray, active will show an abnormal one. Like I said in the last slide, the different treatments for active and the different treatments for latent. So why are TB patients placed on multiple antibiotics for an extended period? This is a really great, important question. So TB patients are put on multiple antibiotics for an extended period of time because if a patient happens to forget to take one dose of medication, they still have 3 other doses to protect them. Because if you do miss one dose or multiple doses, you will have to start the whole process over. Here's an example of the 4 different drugs that are usually taken to treat TB. Which foods might help in fighting TB? So we have calorie-dense foods such as bananas, pork, and cheese. We have foods rich in vitamins A, C, and E. So we have oranges, mangoes, carrots, tomatoes. Protein-rich foods such as eggs, beans, soy, milk, yogurt. And then foods rich in B-complex vitamins, so whole grain cereal, chicken, fish. And then foods rich in zinc, so we have nuts, sunflower seeds, chia seeds, and peanuts. And on the last slide here, so these consumption of certain foods that I mentioned can turn out to be beneficial for a tuberculosis patient. And then there's my works cited. And that is all I have for you. And I want to thank you guys for listening to what I have to say about the acid fast stain and tuberculosis. Thank you.